Katie O'Malley, and I'm a trauma therapist. As the coronavirus spreads, most of us have received the same message, that the safest place for us is home. But for all too many, home is not safe. This pandemic has created a pressure cooker situation for domestic violence survivors, exacerbating stressors, limiting resources, and deepening isolation. As for stress, we know that domestic violence is rooted in power and control. And right now, we're all feeling a lack of control over our lives. And an abuser who cannot manage that will be more likely to unleash violence at home. As countless studies have found, emotionally stressful events can lead to an increase in aggressive behavior at home. Research identified such spikes during the 2008 economic crisis, during major national disasters, and even big football games. Survivors who are now trapped at home are at an increased risk of an abuser externalizing stress, where abusers may leverage COVID-19 to further manipulate, isolate, coerce, or shame survivors while at home. Abusers may even utilize the fear of the potential coronavirus symptoms as a source of power to further amplify the guilt and shame that exists as an undercurrent throughout the cycle of abuse. Abusers may use the pandemic and the stay-at-home orders as an excuse to stop survivors from leaving the relationship. And in addition to being stuck inside with an abuser, job and financial losses can inflame already existing stress. And with gun sales setting records, lethality risk also increases. Reliance on basic sanitation supplies breeds yet another opportunity to exploit power and control, where abusers may withhold cleaning supplies or needed medication from survivors, which can be especially difficult for survivors who are immunocompromised. Survivors who sustain injuries related to violence at home may be less likely to seek medical care for fear of contracting the virus at the hospital. And aside from those fears, as health systems become overloaded, it's more difficult for survivors to access medical care. And since even in the best of circumstances, survivors already have a hard time being heard. Survivors of domestic violence frequently are walking on eggshells, trying to keep the abuser appeased. Getting out of the house can be an enormous relief for survivors, which is no longer available. Staying at home with an abuser could put the survivor under surveillance of resources, potentially limiting safe access to things like cell phones or computers. And given the social distancing-based limitations of most in-person shelters and services, virtual communication with these resources is now more critical than ever. Think about it. A survivor of domestic violence is not likely able to pick up the phone and call for help because their abusive partner is likely in the home or even in the room with them. Social distancing has changed the landscape of domestic violence safety planning, where it's more challenging to find a cover reason to safely get out of the house or pack a go bag, as there aren't really places to go. The economic impact can make it harder for survivors to independently safety plan for an escape. Leaving an abusive partner often involves secretly saving money, which will be more difficult if survivors begin to lose their jobs. And leaving exposes them not just to a deadly virus, but a world that has largely closed its doors. So what can we do to help? While we absolutely want to support these measures of social distancing and isolation, we also need to recognize that it provides an opportunity for abusers to unleash more violence. And it's not that all of a sudden the virus comes along and people become abusive. It's already there. So when leaving is not an option, we have to get creative about ways to help survivors navigate this changed world. Safety planning will clearly look different considering that many will be sheltering in place with their abuser. So we can focus more on emotional safety planning and then physical safety planning. For example, what does it look like for you to reach out in a time of an emergency? What does it look like for you to use virtual tools and to safely access those things with privacy? And what does it look like for you to create physical distance between yourself and the abuser in the space that you're in? For supporters of survivors, consider creating a code word or a code phrase, like, "I'd like to order a pizza," that when communicated with the support means to proceed with the next step of the safety plan. Please practice sensitivity and compassion when evaluating domestic violence situations and while conducting lethality assessments. And if you or someone you know is impacted by power-based violence, know that there is hope and resources exist. Safe Horizon has a chat service on their website for quiet interactions, as well as an escape button, which allows survivors to quickly leave their website without it appearing in their browser history. And advocates at the National Domestic Violence Hotline are available 24/7 via both online chat and phone at 1-800-799-SAFE. And for whoever needs to hear this, you are valid, you are so worthy, and you are enough, just as you are.